Welcome to our informative video on how service-connected obstructive sleep apnea can lead to serious heart conditions like coronary artery disease and heart failure. Understanding obstructive sleep apnea. Obstructive sleep apnea, or OSA, is a condition where the airway becomes blocked during sleep, causing breathing to repeatedly stop and start. This leads to poor oxygenation of the blood and frequent awakenings. Intermittent hypoxia and oxidative stress. During these apneic events, the oxygen levels in the blood drop intermittently, a condition known as intermittent hypoxia. This triggers the production of reactive oxygen species, leading to oxidative stress. Oxidative stress damages the inner lining of blood vessels, known as the endothelium, impairing its function and promoting the development of atherosclerosis, which is the primary cause of coronary artery disease, or CAD. Sympathetic nervous system activation. The frequent arousals and drops in oxygen levels during OSA episodes activate the sympathetic nervous system. This leads to increased levels of adrenaline and other stress hormones. Chronic activation of the sympathetic nervous system raises blood pressure and heart rate, putting significant stress on the cardiovascular system. This chronic stress can contribute to hypertension, a major risk factor for both CAD and heart failure. Inflammation. OSA triggers a systemic inflammatory response, elevating levels of inflammatory markers such as C-reactive protein (CRP), interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha. This inflammation promotes the development and progression of atherosclerotic plaques in the coronary arteries. It can also destabilize existing plaques, increasing the risk of heart attacks. Chronic inflammation can lead to myocarditis, contributing to heart failure. Metabolic dysregulation. OSA is often associated with metabolic syndrome, a cluster of conditions including insulin resistance, obesity, dyslipidemia, and hypertension. These conditions increase the risk of coronary artery disease by promoting plaque formation. Excess body weight adds additional burden to the cardiovascular system, contributing to both CAD and heart failure. Sleep fragmentation. OSA causes frequent awakenings, leading to fragmented sleep. Poor sleep quality is closely linked to higher daytime blood pressure and reduced cardiac repair, both of which contribute to the progression of coronary artery disease and heart failure. Clinical evidence and studies. Multiple studies have shown a strong link between obstructive sleep apnea and an increased risk of coronary artery disease and heart failure. These studies highlight the importance of early diagnosis and treatment of OSA to prevent heart complications. Managing OSA to protect heart health. Managing obstructive sleep apnea is crucial for protecting heart health. Treatment options include using a CPAP machine to keep the airway open during sleep, as well as lifestyle changes such as weight loss, quitting smoking, and regular exercise. Veteran health and support. For veterans with service-connected obstructive sleep apnea, seeking medical advice and support is essential. The VA offers resources and treatments to help manage OSA and reduce the risk of heart disease. Thank you for watching. If you or a loved one suffer from obstructive sleep apnea, reach out to your healthcare provider to learn more about managing the condition and protecting your heart health. Stay informed and stay healthy. For more information, visit our KDVMA website or download the VETS Portal app.